The face is the index of the mind. The human being is having a highly developed psychic area of the brain. It is having highly developed cerebral cortex, limbic system. So the face is having different expressions. It is having multiple openings, like the openings of the eyes, the nostrils, and the oral cavity. In lower animals or the plantigrade animals, the pronograde animals, the face is projectile. The human beings are plantigrade animals and they are having flat face. The unique feature of human face is the elevated or projectile dorsum of the nose, tip of the nose, and depressed root of the nose, the wide palpebral fissure, and eyes are situated in more frontal plane for the stereoscopic vision. The jaws are broad and the chin is protruded to make the oral cavity more roomy. This more roomy oral cavity will lead to the more free movements to the tongue. This free movement of the tongue is responsible for articulation of the speech. The words are formed by tongue, teeth, cheek, lips, and the pharynx, not by the larynx. Larynx can produce only sound. So the unique faculty of human is the speech, articulation of the speech by free movements of the tongue. So in this lecture I will talk about the anatomy of the face. The face is having some unique features which are not seen in other parts of the body. So first of all, I will draw a beautiful face here. Two openings of the eyes, and these openings and muscles which are regulating these openings can produce some meaningful expressions, but these expressions are not the monopoly of these muscles only. The meaningful non-verbal communication can also be produced by the muscles of the tongue and the extraocular muscles. So this is the face having multiple openings. Openings of the eyes known as palpebral fissure, the nostrils, openings of the nose, and the oral fissure or opening of the mouth. These openings are regulated by multiple muscles. These are having a sphincter and multiple dilators. The sphincters which are controlling the opening of the eyes and the mouth are very well developed, while the muscles which are regulating the openings of the nostrils and in some extent the openings of the ears are less developed, not very well developed. So there are some unique feature of the face. The skin of face is highly vascular. Highly vascular skin. Why this skin is very vascular? There is profuse blood supply to the subcutaneous tissue of the face. So skin and subcutaneous tissue. Tissue, that is the superficial fascia. Fascia. These are highly vascular. So when there is any injury on the face, can lead to profuse bleeding. But again, as we have seen in scalp, rapid healing of the injuries of the face due to profuse blood supply. So results in the plastic surgery on face are very good for the same reason, due to highly vascular areas. The skin is having sebaceous glands and sweat glands also. The sebaceous glands are under hormonal control. Sebaceous glands are not under neuronal control. So sebaceous glands are under hormonal control. And these are under control of the sex hormones. When a teenager is under influence of sex hormones, when he approaches his or her adulthood, these sex hormones can lead to inflammation and retention of secretion of these sebaceous glands, and can lead to formation of the acne, a condition of sebaceous gland can lead to formation of the acne. Sebaceous glands are not under neurons, and sebaceous glands are controlled by sex hormones, so can lead to the formation of the acne. The skin is thick and highly elastic. Skin is thick and highly elastic. Why the skin is thick? The face is having multiple sheet-like muscles. These muscles are taking origin either from the bones of the face or the viscerocranium or the subcutaneous tissue of the face, and are inserted in the skin, the dermis of the skin. So it is thick due to insertion of these muscles, and highly elastic and lax also. So due to thickening of the skin and elasticity, when there is some injury on the face, it can tend to formation of gap, especially when the injured part is not stitched in two layers. So two-layered stitching technique should be applied on any injury of the face to prevent the gap in the skin. The skin is lax, so spread of any collection of fluid beneath the skin is very rapid in face, and in some clinical conditions the edema, that is the collection of the fluid, is seen on the face very fast, especially like the renal diseases. In kidney disease, the edema is first seen on the face, especially around the eyes. Due to high vascularity, it can blush and blanch. So this is the unique feature of the skin. Now when we see the superficial fascia of the face, the fascia is having facial muscles. This superficial fascia is having facial muscles. The facial muscles and variable amount of the fat. The amount of the fat is not very high and almost absent in eyelids, but a thick pad of superficial fascia or fat is seen in the region of the cheek between the masseter and buccinator muscle. This pad of fat, known as buccal pad of fat, especially very well developed in newborn and children, to prevent the collapse of the cheeks during suckling of the milk from the mother. So buccal pad of fat is very well developed in newborn and children to prevent the collapse of the cheeks. When we see the deep fascia of the face, the deep fascia is not seen in face. In only some regions, the region of the parotid. The parotid fascia is a layer of deep fascia. The parotid fascia is continuation of the investing layer of the deep fascia of the neck. So fascia covering the parotid is deep fascia, and deep fascia is also seen in the region of the buccinator muscle. In the region of the buccinator muscle, buccopharyngeal fascia. This buccopharyngeal fascia is also covering the superior constrictor muscle of the pharynx. So the skin, the superficial fascia or subcutaneous tissue, and there is no deep fascia except the parotid fascia and the buccopharyngeal fascia. The blood supply, the nerve supply and the lymphatic drainage of the face is seen in this subcutaneous layer of the fascia. So blood vessels, the arteries, veins, nerves and lymphatics are seen in the subcutaneous tissue of the face. Now we will move on the muscles of the face. But before moving on the muscles, we will see the extent of the face. here we will see the extent of the face. So the face is extending from the hairline. This is the hairline, and this hairline is separating the face from the scalp, but the area of the forehead is common in face as well as in scalp. As we have seen already in previous lecture, the frontal bellies of occipitofrontalis can seen in this area. So the muscle is common for face as well as the scalp. It can also move the scalp, it can also move the front of the forehead and can wrinkling this area. So occipitofrontalis muscle, or especially frontalis, is common to the forehead. Laterally, anterior part of the auricles, so running from here and laterally from here. Inferiorly, the base of the mandible and the chin, a lowermost part. So this area is considered as the part of the face. When we see the muscles of the face, functionally, first of all, I will explain the embryological development of the muscles. So embryologically, the muscles of face are developing from the mesoderm of second branchial arch. In the fetus, in the embryo, what we see in the embryo, in the region of head and neck, there are the branchial arches or pharyngeal arches. The first, second, third, fourth, fifth will disappear, and this is the sixth. This is the second branchial arch. This second branchial arch, mesoderm, will form the muscles of facial expression, and the nerve of second branchial arch is the facial nerve. So facial nerve will innervate all muscles of the facial expression. The facial nerve. From the area of the neck, it will move in the area of the head, and it will form all muscles of facial expression. This is the first branchial arch, and mesoderm of first branchial arch will form muscles of the mastication. So these are lying deeper to the muscles of facial expression. These will also move in the area of head. These will also move in the area of the head, but the ventral part of the first brachial arch will obliterated and the second brachial arch will overlap the first brachial arch due to this obliteration. So muscles of facial expression are superficially situated than muscles of the mastication. So embryologically, the muscles of facial expression are developing from the mesoderm of the second brachial arch and innervated by the facial muscle. Morphologically, these are considered the best remnant of the panniculus carnosus. Morphologically, these are the best remnant of panniculus carnosus. The lower animals are having a continuous sheet of subcutaneous muscle known as panniculus carnosus, and lower animals are having a continuous sheet of the subcutaneous muscle known as panniculus carnosus. But due to this single sheet of muscle, these animals can't express different expressions because there is a single muscle. So they can't laugh, they can't be angry, they can't be sad, and there is no sneering and snarling expression in lower animals due to this continuous sheet. But as human being advances in the development, some parts of panniculus carnosus disappear. Some parts of panniculus carnosus disappear and it will form multiple muscles. The formation of multiple muscles by disappearance of parts of panniculus carnosus will lead to formation of the muscles of facial expressions. Different parts of the muscles can produce different facial expressions, while a single sheet of muscle is not able to produce different expressions. So this is the unique feature of human beings. As we all know, face is unique identity of a individual person, and it makes the human being unique and different from other humans. So human being is different from other animals by the remnant of the panniculus carnosus. Now we will see the muscles of facial expressions one by one according to opening of different fissures or other openings after a short break.